Good morning, ladies and gentlemen. Welcome to the Heritage Foundation. Today we're going to have our first panel on medical innovations, medical technology, and how to make America healthier again. Restoring American wellness is a top priority in domestic policy for the Heritage Foundation. And today we're going to focus on two technologies, photobiomodulation and hyperbaric oxygen therapy. Both technologies, so you all know, are federally approved therapeutic devices for certain medical conditions. Photobiomodulation, or PBM as it's often called, is a medical technology that uses infrared light to stimulate and restore cell functions and reduce inflammation. The CDC endorses PBM for pain management as an alternative, for example, to opioids. The Veterans Administration uses the PBM approach for neurological conditions and the treatment of traumatic brain injury. So globally, the case with PBM, there have been literally 100 million patients around the world that have been treated with this technology. And it has been the subject of literally thousands of research studies, peer-reviewed research, including research in journals like The Lancet of Great Britain and also the Journal of the American Medical Association. Hyperbaric oxygen therapy, many of you may have heard of it. It's the administration of 100% pure oxygen in a highly pressurized chamber. It helps to repair and stimulate cell growth. It was originally the standard of care for carbon monoxide poisoning and decompression sickness in diving accidents. Medicare today, which covers 69 million Americans, basically authorizes hyperbaric oxygen therapy for about 14 specific medical conditions. A key question that we are going to address today is, can these proven therapies, which are proven in certain routine cases, can these be expanded to treat other conditions? And to help answer this and other questions, we're joined by three truly outstanding panelists. Dr. Ann Liebert is a clinician and a scientist, and among her other academic positions, she is currently the coordinator of photomolecular research at the Sydney Adventist Hospital in her native Australia. In 2022, she was the winner of the Rosalind Franklin Award for the treatment of symptoms of Parkinson's disease with photobiomodulation. Dr. Paolo Cassano is an associate professor of psychiatry at Harvard University. He is also the director of photobiomodulation at the Massachusetts General Hospital in its division of neuropsychiatry. He's very much involved in clinical work and also research work on depression. Dr. Mohammed Alamir is a specialist in internal medicine. He's a leading physician at the Aviv Clinic in Central Florida, a graduate of Rutgers University and St. Matthew's University School of Medicine. Dr. Alamir specializes in high-pressure oxygen therapy, particularly in some very critical areas like stroke, traumatic brain injury, and age-related cognitive decline. Mental decline. If you're running for office, it's something you might want to consider. In any event, I might ask my friends and colleagues to join us. Thank you. Well, I think, this is a very unusual topic for a general audience, but I think the most important thing to do is to start at the beginning and get to the basics. And so I'm going to start asking Dr. Liebert a very, very simple question. It's simple, but I'm sure it's got a complex answer, and I'm going to ask you to be kind to all of us. What is the science behind PBM?
In terms of the body, so PBM stands for photobiomodulation, which is the use of light, non-thermal light, to affect healing. We have been utilising light clinically in medicine since 1903, when Niels Finsen won the Nobel Prize to use light in light tubes to help with the two illnesses of smallpox scarring and tuberculosis scarring. So it has started in a more modern time in 1967, when a Hungarian doctor, Dr. Mester, found that it was able to heal wounds and grow hairs back as an incidental finding in experiments he did for the cancer. So it has effect. So light is a natural changing of all of our body's activities. We know it affects our circadian rhythms. Waking up in the morning, we know the healing morning light has a great effect on our mood and our healing. Light in the middle of the day affects our brain waves completely differently to light in the morning. And in the evening, if we have too much blue light, it affects our circadian rhythms in a detrimental way, and we don't have sleep. So we utilise light in a therapeutic way by applying it to the body, and it has a cellular and a subcellular effect on inflammation and pain. And we'll go into the mechanisms a bit more later, but basically it stops inflammation to help with the healing of both acute and chronic injuries, and it is very effective as a treatment, a non-pharmaceutical treatment that has absolutely no side effects and a long history of efficacy for over 40 years.
Thank you. Dr. Elamir, on the subject of high-pressure oxygen therapy, what is the basic science? What, in other words, should our audience know about high-pressure oxygen therapy?
That's a great place to start, Dr. Moffat. You know, we're all breathing oxygen right now, and all of our cells need oxygen. The basic principle of hyperbaric oxygen therapy, or HBOT, is to have oxygen, 100% oxygen, under a pressurized environment. So I'm going to take you all back to high school physics. Henry's law: a gas under pressure can increase the concentration of gas delivered. So as we age, as we have injuries, we're inefficient at getting oxygen to the cells that need it. And hyperbaric oxygen, with that principle, is a great way to get oxygen to the cells that need it. But even past that, this is something we've known for hundreds of years. Scuba diving accidents, decompression sickness, et cetera. But specific protocols that fluctuate oxygen levels can trigger your body to heal. It can trigger your body to create new cells, new blood vessels. So if we're talking about an injury, yes, we want to get oxygen to the cells that are injured, but we also want to heal it, repair it, replace the cells that have been injured. And with the right protocols, hyperbaric oxygen can do that.
Well, thank you very much. I want to follow up on this with Dr. Cassano, the issue of PBM. Specifically, if you could tell us exactly how does it work? What is the mechanism of action for a PBM?
Yes, no, absolutely. Dr. Liebert has already explained broadly the mechanism. I want to say that sometimes people think, okay, well, where has that been seen? And the good news is that we've seen these things in the brain, in the human brain. With imaging techniques, we've seen in the human brain, in healthy subjects, that actually brain metabolism was boosted. So that was found with MRS spectroscopy. We've also seen with MRS that inflammation in the brain is decreased. So we've seen that cerebral blood flow is increased. So this is true for us in people that are either healthy or have brain condition like a major depressive disorder or traumatic brain injury, including boosting brain oscillation. And that's seen with EEG. So that's true for us.
Yeah. Dr. Elamir, the same question really. With regard to high-pressure oxygen therapy, what is exactly the mechanism of action? How does it actually work?
Yeah, so I described how breathing 100% oxygen under pressure can increase the oxygen concentration. So for example, if you go to a pressure level of 2.0 atmospheres of pressure, that's one unit of measurement for hyperbarics. That's like diving 33 feet under sea level. So if you breathe 100% oxygen under 2.0 atmospheres of pressure, your oxygen concentration is 17 times higher than normal. Imagine that, getting oxygen to all the cells that need it. You no longer have to rely on the little red blood cells swimming in your arteries to try to capture the oxygen and transfer it. It automatically gets to the cells. That's the first principle. But over the last 15 years with our research, we discovered that if you fluctuate oxygen levels, for example, get it very high and get it to normal and go back and forth, this principle is called the hyperoxic-hypoxic paradox. It basically means that when your body is or thinks it's in a low oxygen environment, that's a trigger. That's a trigger to say, I'm in danger. I'm going to lose cells from hypoxia. I need to build new cells by creating new stem cells. We've all heard of stem cells. Stem cells are blank cells that could become any cell we need them to be. When we're young, we have a lot of them. As we age, we don't have as many. So we lose that ability to repair and replace cells. This protocol, this principle of fluctuating oxygen levels tricks the body. High to normal makes it think it's in low oxygen. So thereby triggering that reflex of the body, say, I need to replace the cells that are about to die or that are injured. I need to grow new blood vessels to help usher better blood flow to my organs that are starving of oxygen and be more efficient with energy metabolism. So our bodies have this capability, it just needs the right trigger to create and repair.
Oh, well, you know, these things sound very interesting. They sound terrific, but I've got to ask a very basic question, which has to do with side effects. I know all of us watch television, right? We see these drug ads, and there's usually some young couple, you know, prancing through the meadow, and there's a drug being advertised to solve some kind of a skin problem. And then, of course, you get the the routine, you know, yes, this drug is very, very good for treating psoriasis, of course, but it results in heart failure. The side effects include heart failure, liver damage, and death. You know, and the couples continue, of course, to prance along. Run out and tell your doctor, got to have this drug. I only bring this up, not because, you know, this is not an anti-pharmacy thing, but I'm just simply saying that there's no drug that's effective that does not have a side effect, right? The question is, you're talking about two rather significant technologies which have a big impact on cell tissue. So I'm going to ask Dr. Liebert, you know, what are, if there are, any side effects to PBM?
That's a great question. And in the 100 million treatments in therapy sessions in the clinic since 1967, there has been not one adverse outcome, which is in contrary to what you've said. There are some minor reactions that are transient and temporary. So if you are a very sensitive person to light and you have a migraine history, you may get a slight headache for a very short time that would be gone within 24 hours. But the good thing, if you're sensitive to light, that makes you very receptive to the treatment and you're more likely to be a responder. So no treatment has 100% responders. We have super responders, and a few non-responders. But if you are sensitive to light, you're more likely to be a responder. The only contraindication is if you're on an antibiotic or some sort of other medication that you're very ultra sensitive to light, that you can't go out in the sunlight, obviously that will be a contraindication to having photobiomodulation. But no adverse effects. It has sometimes it has improved effect to other effects, but we can talk about that later.
Okay. Dr. Alamir, I've got to ask you the same question. We all love oxygen. Oxygen is going, you know, that's why God made blood, to provide oxygen to the tissue. But high pressure oxygen, under very high pressure, have there been any side effects to using high pressure oxygen therapy?
Of course, there are side effects to almost everything. If you drink too much water, you could have a side effect. You could get hyponatremia, et cetera. Now, hyperbaric oxygen, of course, oxygen is a great thing. We need it to live. But too much oxygen is also dangerous. Oxygen toxicity is a real thing. So it is very important to understand what the right levels of oxygen, the right levels of pressure, because the higher the pressure, the longer you're on that oxygen, the higher the risk of oxygen toxicity. So we have very specific protocols, not only to be effective, but also to be safe, to mitigate the effects of oxygen toxicity. The other category of side effect is something called barotrauma, trauma from pressure. So who here has been on an airplane and when it's landing, you're like, ooh, my ear wants to pop. Let me try to pop it. Let me chew some chewing gum, right? All of us. If you're a scuba diver, you know as you dive, you have to equalize. Because if you don't equalize the pressure, you're going to get stretch of your eardrum. So the most common side effect isn't really oxygen toxicity if you do the right protocols, but it's actually trauma from pressure. So in our chambers, we have large multi-place chambers where you sit inside and there's an inside attendant with you. Their job is to make sure you're equalizing, popping your ears as we're descending, as we're increasing the pressure. As long as you're able to pop, you're going to be fine. If you can't pop, you just let the inside attendant know right away. We stop the pressurization and you're able to continue. The problem comes when you're a brave soul and you don't want to be embarrassed and say, I can't do it, I don't want to disturb anybody else, and you try to force it. We can see your face. You're going to be wincing in pain. And as long as we stop it, you're going to be fine. So done the right way, these are very minimal, but it's always a possibility.
I want to dig a little deeper on this. When you talk about oxygen or toxicity, oxygen toxicity sounds strange, but what specifically does that mean? In other words, how does that manifest itself? For ordinary people, how would they know that they're dealing with this problem?
Absolutely, and you might have heard of something called oxidative stress, but oxygen toxicity is its own thing as well. So the signs of oxygen toxicity, you can imagine being drunk on oxygen. You would be confused. You might be irritable. And if you're exposed long enough, you could even get seizures. Now, it would require a tremendous amount of time on the oxygen, high pressures, unsupervised, et cetera. That's why hyperbaric oxygen, consider it like a surgery. You're not going to go to the guy in the street and say, hey, can you do a facelift for me? Are you going to trust them? No. Same thing with hyperbaric oxygen. The term hyperbaric oxygen has now been kind of spread to everything. Medical grade hard chambers, soft tents that you have in your room, in your bedroom. It is important to consider hyperbaric oxygen as a medical therapy and having the right supervision, just like you wouldn't trust somebody to do your surgery.
Right. Thank you very, very much. A big question with anything, whether it's a new drug or new technology, new medical therapy, is a very simple one. And it's a question I think you've already anticipated, but I want to dig a little deeper onto this, and that is, does it work? There's so many things today. We're getting all kinds of things over the internet, saying that this works, try this, this will end tinnitus forever. If you've got atrial fibrillation, you'd solve that, take this and that and the other thing, and it'll go away. So we have, there's an understandable skepticism. And that would certainly apply here to the public, which is, generally speaking, not familiar with either of these technologies. So the question is, how do we know it works? What is the clinical evidence with regard to the success of PBM, its effectiveness? And do you have any examples of a patient, for example, that has gone through this? And Dr. Cassano, I'd like, because you're up there at Harvard, Massachusetts General, and I imagine you get a number of patients. And have you had an experience this way where you've had, some very specific successes?
Yes, we have. So our clinic for photobiomodulation applied transcranially to people who have brain disorder has been approved at Mass General Hospital for about 10 years. And we have patients of ours that have spoken publicly and have given testimonial. And as of late, we have one of our patients, and that's why I can talk about it today, that spoke about traumatic brain injury. A really touching story of a man who, in a street in New York, had a crane falling on his car and had traumatic brain injury related to that. Basically, he went with his head through his moonroof of the car and had a devastating traumatic brain injury that had a repercussion in terms of memory and a headache that has been haunting him for years. Thanks to Dr. Marnie Nazer, found out about photobiomodulation and started that on his own at home and had some improvement. However, the pain had not gone away and reached out to our clinic. And that's when we started an intensive protocol. And I agree with Dr. Lamarier that medical follow-up and dose are key here. And with the appropriate treatment over 8 weeks, it came to a point, actually it was at 6 weeks, we were in office and he had this aha moment to say, wait a minute, Dr. Cassano, my headache is gone. And that was amazing for him. And he's a biker, he's a cross-country skier, he's 80-year-old, and he's doing all these things. And it's amazing.
Yeah, it is amazing. Let me ask you this, Dr. Alamir, you must have had a number of experiences down in Florida with patients coming in with looking for relief. Can you tell us about any experience you've had in this area?
Absolutely. So, you know, we were joking about the aging process and politics. Well, the aging process is happening to all of us, right? And, you know, raise your hand if you're just as sharp as you were 20 years ago. There's always one or two people that raise their hand. So I gotta talk to them first.
Yeah.
But
I think they need to go under oath.
yeah.
Pam Bondi might want to talk.
Well, we have a saying in our clinic: the brain does not discriminate what hurts it. So whether it's the aging process, a stroke, a traumatic brain injury, and when I say traumatic brain injury, that means you could have a fall, hit the concrete, you could be hit by a Ford Explorer, or a baseball bat, what have you. Injury is a wound. When you have a wound in the brain, it needs healing. And that's where hyperbaric oxygen comes into play. We know about wound care with hyperbarics. The wound in the foot is no different from the wound in the brain. And we have plenty of clients. Being in Central Florida, we have a lot of aging clients. So yes, we do focus on aging. But we have people coming from all over the world coming in for traumatic brain injury. We have young people that had traumatic brain injuries. And when they come in, their lives are disrupted. They have to stop school. They have to stop work. They have headaches. And we know about concussions, and maybe in the sports world you're familiar with concussion protocols. But that process is a chronic process. Concussions, yes, they happen immediately. You have a protocol, you have symptoms, and then you have different symptoms that come along the way. You can have cognitive changes years after your head injury, but it could be tied to that head injury. So chronic tissue injury, that's the key. And if we can heal it, whether it's the stroke or the traumatic brain injury or aging, that's something that we see every day.
This business about wound healing and hyperbaric oxygen therapy has been very successful on this. I know that, as I say, that's one of the conditions that Medicare covers is wound healing. But one of the things that just strikes me about all this, and I'm raising this with the audience generally, and I'd like you to take a stab at this, Doctor, and that is certain types of surgeries that are rather extensive. And I'm talking about things like gastroenterological interventions, prostate interventions, things of this sort. Some of which are rather painful, in terms of recovery, and some of them take quite a long time. I know this is a kind of a basic question, but how come the medical profession hasn't discovered this as a way to basically make life better for post-surgical recovery for millions of Americans who go through some of these rather difficult surgeries? If you have a thought about it.
Yes, absolutely. And I think the question is about timing, because the mainstream or even insurance reimbursement will cover hyperbaric treatment for wound healing when the wound has failed. So for example, if you have a surgery and there is lack of healing, and in the end, what happens when you have a wound? You have lack of blood flow, lack of oxygen, and you have an inability to heal that tissue. So they will acknowledge that hyperbaric can help, but they wait till it fails before they'll approve it. Now, I think the point of us being here today is...
It's a perfectly rational response.
And unfortunately...
I should have thought about it.
Everything from medical training to reimbursement, we're taught, okay, when the problem happens, what do we need to do? And I think today is a good first step in a growing momentum of what can we do to prevent bad outcomes? What can we do to improve outcomes? Because my favorite condition to treat is prevention. If I can get you to help prevent you getting dementia, or prevent you from getting a stroke, or prevent you from getting a failed wound from healing, then that's my purpose as a physician. Yes, I am here for you if you have an issue and if you have a problem and I can help you, but I'd much rather prevent it from happening. So right now in our clinic, we are treating surgeries before the surgery even happens. Before the surgeon makes their cut, we do hyperbaric treatments to start the healing process before the injury happens. And then, of course, as soon as they're done with the surgery, as soon as they're able to come into the clinic, we treat them with the hyperbaric after, and we have significantly better outcomes, faster recovery, and much less failures.
Dr. Liebert, you were agreeing. I mean, these seem to be complementary technologies in many ways, and I'm just wondering, with regard to post-surgical events, can PBM be effective in promoting faster?
Well, certainly, to your other questions, there's been more than 10,000 trials about the efficacy, and the trials that I have done in our hospital have been pre and post surgery, including for cardiac surgery. So one of the treatments with surgery is major coronary artery surgery. You often get a side effect of scarring of the heart. So both in other research prior to our clinical research, it shows that if you do the treatment beforehand, then have the surgery, there's 67% less damage to the heart. And so as a routine trial we did at the SAN, we went and did the PBM treatment the day before the surgery and then after the surgery, and we were able to decrease potential complications like atrial fibrillation and other scarring, and people recovered more quickly. And so I think the most important thing, whether it's going into a football game where you are going to be damaged, or going into surgery where we know we're going to have surgical trauma, that we do the treatment before. And that's what we would like to do, as well as treat with the efficacious treatment after we have the injury in the wound, which we do have guidelines for as well.
Sure.
But I agree, why don't we treat it before? And especially there's something called post-operative cognitive dysfunction that usually goes after 3 or 6 months. But in very elder people, it can persist. And in my experience in my clinic, with all the people that have major surgery, even into their 90s, I do not know of one person that's had any of the post-operative cognitive sequelae, and I'm very happy with that.
Okay. You know, when we talk about health policy and we talk about healthcare delivery and so on, one of the key issues, it's a problem, all over the world, but increasingly, we are concerned about access to specific medical conditions, specific medical treatments and procedures and so on. It's a major issue in health policy, is access to care, especially among lower income people who are marginalized in some way. But I would like to ask you this question. Access is always a major problem. With regard to PBMs, and I'm going to talk to Dr. Elamir about this too, but with regard to PBM, is access really a very big issue? In other words, is the device, the medical technology, easy to use? And where is it available? Dr. Liebert, can you tell us?
So the access is very easy. Is it reimbursed? So certainly in the veterans system in the hospital, there are regulations pertaining to that. It should be, and I think there's a question of 3 out of 171 hospital have got access to photobiomodulation in the clinic. In terms of the regulation for treatment for surgery that you asked about before, there is rules that we would like to have sort of disseminated, that you can have photobiomodulation instead of opioids after surgery, and Medicare will cover that. In terms of access at the moment, it depends on your actual state. In allied health, in physical therapy and in chiropractic, you can have treatment in the clinic, which is very affordable, or we now have home devices, many different types, both clinically that Professor Cassano can talk to more in the transcranial, but also these other home devices, and they're very accessible. If you have an acute injury like a sprain or a tendon problem, you would only need a few treatments. You can have that in the clinic. If you have more a chronic intractable problem like Parkinson's, and that's what we treat in our clinic, you might have to have a home clinic. But the really exciting thing is as access is increasing because we have access to medical grade treatment at home. And over 5 years in our Parkinson's patients, we have been able to see an improvement, and 5 years later, no progression in symptoms of balance by using home treatments.
Dr. Cassano, do you have any other observations on access issues?
Yeah, I totally agree with Dr. Liebert. You have to know that the FDA consider these devices as minimal or non-significant risk devices.
Oh, okay.
They are that safe that they can be sold over the counter. So if you decided, you can actually buy some of these devices. Of course, you would have to be careful because you want devices that are have proper dosimetry, and if you had a condition, you want to have a proper medical follow-up as well and guidance. So the issue is not so much access to the technology itself, is access to professionals that are qualified, and that's where we're working on.
Dr. Elamir, hyperbaric oxygen's been around for quite some time. I mean, back in the Navy used it for decompression sickness. That's where we first started seeing the use of it widespread. But today, I mean, there was a period, when you would read newspaper articles about, Hollywood celebrities, Michael Jackson, for example, using high pressure oxygen therapy and so on. But here's the thing, with ordinary people, is access a problem, in your opinion, given your experience in Florida? Is access a problem for getting hyperbaric oxygen therapy? Is that an issue?
Yeah, I will say access to the proper hyperbaric oxygen is
Okay.
a problem, because the term hyperbaric oxygen, as I mentioned earlier, is thrown out to say the medical grade hard chambers. And I would say medical grade hard chambers could be categorized into two. There's the monoplace chambers. Basically, if you've seen somebody lying down horizontal in a tube, that's a mono chamber. That chamber is pressurized with 100% oxygen, and you're getting that high pressure, high oxygen effect. What we use in our clinic, and a lot of major institutions will use something called a multi-place chamber. So imagine going into an airplane fuselage. An airplane fuselage, there's a bunch of seats. So in our multi-place chambers, there's 14 seats, and the chamber is pressurized with normal air, and each individual is given an oxygen mask. Now, when the mask is on, it's the same as that mono chamber. High oxygen, high pressure. But the multi-place chamber allows for the proper fluctuation protocol that I described earlier to get to the changes of the brain and the aging process, et cetera. So, I always like to caution people, not all hyperbaric is created equal. You'll see athletes using zip-up tents or soft chambers. And access to those are a little bit easier because it's something you potentially could have in your own home. But to have the effective protocols, you need the right pressure and the right concentration and the right professionals to administer it for safety and efficacy. So I think as we get the research and data to continue, we'll have more centers that have the proper medical grade hyperbaric.
Right. All right. Well, now we're going to talk about the thing that nobody likes to talk about, which is the cost. The United States spends more money than any other country in the world, both in aggregate spending and also on a per capita basis. It's $4.9 trillion, according to the most recent data. It's a big issue. Americans are constantly complaining about the cost of medical care, cost of insurance, their premiums, their out-of-pocket costs, the cost of drugs, prescription drugs, and so on. Here, we've got these two technologies, both that have been around for quite some time. Let me ask you the basic, fundamental American question, which is, how much is it going to cost me? Dr. Cassano, can you tell me what we know about the cost of treatment for PBM at Massachusetts General, which is a pretty fancy place, so.
Yes, so let me start by saying that if you buy a device that is properly dosed for at-home treatment with a reliable company that has all the dosimetry in place, with a few $1,000s, you can buy a device, even get that device for 6 months at home for you to try it and trade it back if you're not satisfied. So it's very affordable when you compare with the actual cost of an ongoing pharmacotherapy, which oftentimes means multiple medications being taken in a cocktail of pharmacotherapy. And don't get me wrong, I am a physician, I'm a psychiatrist, I prescribe medication, I'm all for evidence-based treatment. But to the question of cost, PBM, it's very competitive. Now, when you think about in-office high-power treatment, then you have all the added cost of the visit, the space, and so that's a little more expensive.
You know, as would be, for example, in a hospital setting like Mass General. Give us a ballpark figure. Let's say we wanted to have a PBM device at home. What are we talking about in terms of cost?
Yeah, somewhere in between $1,000 and $3,000.
$1,000 and $3,000. Is how much of that? How much is this covered by insurance? How is this basically an out-of-pocket cost for most people, or is this covered by insurance?
Right now, I'm talking about transcranial photobiomodulation for brain disorders,
yeah, right.
And that is not covered by insurance.
Okay. On a treatment basis, somebody goes into Massachusetts General for treatment. Let's say it's a serious issue. What are we talking about in terms of hospital costs?
Right. So the evaluation and the follow-up visits are entirely covered by your insurance, right, because it's a psychiatric or neuropsychiatric evaluation. However, the sessions, they're not reimbursed by the insurance. So we work with the hospital to bring it down to what would be an out-of-pocket psychotherapy session. So the cost is $250 per session.
All right. Okay. Dr. Elamir, what can you tell us about HBOT and the cost of high-pressure oxygen therapy sessions?
Yeah, and I think I'll keep it to the medical grade hyperbaric. So yeah, your medical grade hard monochambers, multi-place chambers. It can range anywhere from $300 a session, but most protocols require more than one session. You're not going to have that oxygen fix you in one treatment. Most protocols will take anywhere from 10, 20, 40, 60 treatments. So that could range anywhere from 300 to tens of thousands, depending on the indication. As a device, it's not something that I would say, hey, just go on Amazon and pull up your medical grade hyperbaric chamber and install it in your house. That's not going to happen.
Stay away from the internet.
Yeah, well, for sure.
Okay.
Yeah, be careful what you buy, because unfortunately, even with medical grade, you need the proper facility to administer it. Even medical grade hyperbaric chambers, especially monochambers. Taking you back to high school physics and chemistry again, oxygen is a combustible gas. So if you have a spark with oxygen, and you can see very quickly on the news where even medical facilities that have monoplace chambers can have explosions and accidents, and it's very unfortunate. So, when it comes to your health and your safety, don't let cost be the barrier. Make sure you first see what's the right indication, the right place, the right facility, the right protocol, and then that way, everything will be done evidence-based in the right way.
Okay, thank you very much. I would imagine that the use of hyperbaric oxygen therapy could be cheaper in some respects than more conventional therapies. Can you think of an example, Dr. Liebert, where that would be true?
I think that.
Less expensive, perhaps, than the standard conventional therapy.
Yes. And so, for example, there is consideration for something called oromucositis, which is when you've had cancer radiotherapy or chemotherapy, often have severe sores on your mouth.
Yes.
And that often requires you to be hospitalized. Sometimes it stops you having your treatment. Sometimes you have to have a peg in your stomach because you can't eat. The average cost for treatment for oral mucositis that's severe, which happens in some instances in 90% of the case, is about $70,000. And in our hospital and in many places like Children's Hospital St Jude's here in America, the treatment for photobiomodulation, which is to the extent of a few treatments before and afterwards, during the time, completely obviates that $70,000. So it is a saving both to the person, to the community, and to the health insurers as well. And any ongoing problem with opioids or ongoing problem with the sequelae of having long painkillers is also into the mix. And this is a very inexpensive way to have people improved and healthy more quickly and sustained, and that's a large saving.
Yeah, well, I think that, your point about pain management, obviously, the federal government has recognized that this is a better alternative than opioids for reasons which we are all very familiar with in the United States. It's a tragic, it's an unfortunate situation that's happened in the United States. It's probably happened in other places as well. I want to get to the issue. I mean, this is a highly specialized field, and there is a whole class of top-tier medical professionals who are very, very deeply involved in both PBM and also hyperbaric oxygen therapy. I guess the question I would like to pose to you is, how is this approach, both approaches, how is this accepted within the general medical profession, within what we would call mainstream medicine? Is PBM accepted within mainstream medicine? I guess, Dr. Cassano, I should probably ask you that question first, because you're at the heart of it, actually, right in Massachusetts General and Harvard Medical School. I mean, so tell us.
I am smiling here because the answer is no.
Okay, all right.
It's not accepted, and you have to understand that we were never trained to any of this, and part of it is because we are doctors in medicine and surgery. That's what we're trained to prescribe and to perform surgery. And to be fair, that's where the evidence for decades has been accumulated. And now we are at a point where we have decades of evidence over these new treatments that are wellness grade, but the professionals are not familiar with this. And the fact that they are very safe and the FDA consider them minimal risk doesn't mean that the professionals shouldn't be the ones that are using it. And that's where we are at. We really need to bring the professional up to speed.
Right. Dr. Elamir, with regard to the general population of mainstream medicine and so on, what is the story with regard to high-pressure oxygen therapy?
Yeah, and hyperbaric oxygen, we already know, is covered for 14 diagnoses, but most of those diagnoses are related in the wound care world for your standard doctors. So infectious disease doctors, surgeons, vascular surgeons, those kind of things. They will know about hyperbaric quite well. We joke about mainstream medicine. I'm a board-certified internal medicine physician. I'm an internist. I'm still part of the mainstream medicine. I still prescribe. I still treat diabetes and heart failure and all those other things. But if I may just tell a quick story of how I even got wind as an internist of hyperbaric oxygen for brain health. It was my late father. My late father was a neurologist. A year after he retired, he suffered a stroke. And as anybody who has had experience with stroke, you have a very limited time window to act, to make something heroic happen. And if you don't make that window, you're said, sorry, you're out of the window period to give you a clot-busting medication, for example, and do speech, physical, occupational therapy, and that's it. It's never too late to treat a stroke, or it's never too early to treat a stroke. Meaning, it was his stroke that led me to research, what can I do to heal the brain from a stroke after the fact? Days, weeks, months, years later. And my colleague and mentor, Dr. Shaya Fradi, in Israel has had studies, randomized controlled studies, showing hyperbaric oxygen can heal the brain months and years after a stroke. That's how I found how hyperbaric can help the brain. And the studies include traumatic brain injury, it includes the aging process, cognitive decline. PTSD is a condition that we attribute as a psychological disease, but it is a brain physiology disease. When a veteran comes from war with a wound on their leg, you see it, but often we don't see the wound in the brain. We have the ability to do specific scans to see the wounds in the brain. And Dr. Afradi and Dr. Hadani, my colleagues, they are treating PTSD as a neurological brain disease with hyperbaric and having amazing results.
Thank you so much. Listen, we want to give the audience a chance. Oh, Dr. Cassano, you wanted to say one more thing.
Yes, just we want to say that my answer was specific to photobiomodulation for brain disorders.
Okay, I understand. Okay, we're going to open this up for questions, and let's see. We have one here. Yes.
Hi, thank you all. So this is for anybody on the panel. Are there any benefits besides pain management and recovery for either technique, say autoimmune disease, gut health, anything like that? And then specifically, I can speak for Dr. Elamir, do you have any information on ozone and how ozone therapy is different or might work in conjunction with the hyperbaric chamber?
Yeah, great question. I can speak to both. With gut health and autoimmune diseases, I have a client that had Crohn's disease. So Crohn's disease is an autoimmune condition that attacks the lining of the intestines from mouth all the way out. And she tried biologics, didn't work, didn't make her feel well, steroids. These are kind of the old school, mainstay therapies for these diseases. Well, she had colonoscopies before the treatment, and she was, a retiree, so we were treating her for healthy aging. And as she went through the treatment, she had improvement in her bowel movements, her gut health was improved. She had scopes after the treatment was done, and they saw a reduction in the ulcers in her intestines. She had a follow-up, 6 months, 1 year, 2 years later. There is almost no evidence of the Crohn's disease within her intestines. So there is great evidence out there that shows hyperbaric oxygen as an anti-inflammatory, as an immune modulating treatment, and of course, with our protocol with regeneration of new cells, a great way to heal the gut from whether it's autoimmune or otherwise. To your second question, ozone therapy, for those of you that don't know, we're all breathing O2. Ozone is O3. So there are applications for ozone therapy for different things. I would put it as a completely separate category as hyperbaric. So to my knowledge, there aren't any studies that kind of show a combination of using the two, but it does have its own benefits, whether it's antiseptic or immune modulating or autoimmune, but that's separate from hyperbaric.
And we've found, to your question, IBD is a risk factor for Parkinson's disease, and we have been doing research both in vitro but also clinically for over 5 years, measuring the microbiome. So as our people in our proof of concept trials, now our randomized controlled trials, and now their larger randomized controlled trials, as well as our clinical patients, have found when they have improved their symptoms of Parkinson's, which is getting their sense of smell back, walking better, having better balance, having less depression. We have measured their microbiome, and my husband, who's here, is a microbiologist, has done all the genetics. And we found as the people improved, got their sense of smell back, where they weren't able to smell anything for 4 years, their microbiome improved. And we're presenting in the neurology conference in New York next week, our 5-year microbiome results longitudinally when our people are still better after 5 years. We've also in the middle of doing a trial in specifically irritable bowel disease and Crohn's up in Queensland, and the early signs that we've presented are very positive. So the way that photobiomodulation works, it modulates the signaling of the cell, so it has an anti-inflammatory, which has an autoimmune modulatory effect as well. So yes, we are treating all of those diseases, especially constipation and other symptoms of IBS.
Okay.
Yeah, just briefly, and most general, we've seen in patients with acute TBI that by providing 3 treatments within a week, we could in fact prevent the secondary neuroinflammation from the TBI.
And very interesting to that, in our studies, you change the microbiome after 2 days of having a TBI. And so, yes, the mechanism is complex of these treatments working, but I'm absolutely sure that we treat the microbiome.
Okay. I think we had another question. Yes.
A patient Lyme patient who's been doing all of similar things or like ozone therapy, oxygen, IVs, hyperbaric. What has been, with integrative doctors, and they have flown under the radar for 15, 20 years, what do you think is the biggest challenge to get this more mainstream? How much of it is the cabal side of medicine that blocks stuff like this? How much of it is politics and money versus just educating the consumers?
That's a great question. I can approach it from a couple different points. Number one, as I mentioned earlier, I think part of it is in education. I think from medical training to medical practice. If my dad didn't have his stroke, I don't know if I'd be here today, frankly. I would be like any other internal medicine saying, hey, yeah, I know about it for wound care, scuba diving accidents. I had no idea hyperbaric oxygen with the right protocol can heal the brain. So I think education is number one, and that's a big role that we have in the field to continue to educate everybody, including people in the medical field. The studies are there. We have many randomized control, sham-controlled studies that prove this helps cognitive decline, stroke, traumatic brain injury, PTSD. It is already being offered in other countries and covered. So I think I want to thank Dr. Moffitt and everybody here for allowing us to tell you this, because that's the next step. We just need the people to understand it, to fund it, to adopt it, and whether it's more funding for more studies to confirm, because as researchers we joke, I love my study, but I want more, I want more, I want more. But as a physician, when I'm standing in front or sitting in front of a patient saying, I have data enough to tell you I can help you, I'm not going to wait for the next study to confirm what I already know. And I need to get you in right away.
And so,
Yes. The gentleman up for here. Yes, go ahead. And then, yes, sir, next. First you. Yes, okay. Thank you.
Good morning. My name is Dean Calcani. I'm a former Army physician. I continue to work with DOD in a variety of areas in medical research. And more of a comment than a question, as I'm sure you all know, we have thousands of service members with traumatic brain injury, and we recognize that PBM is a very promising technology. There are ongoing studies, clinical studies, both in the DOD as well as in the VA, using it for TBI. I believe it's also being used to help service members return to duty with various musculoskeletal ailments. And then just, if I could go down another road, I have an adult daughter with severe autism, and I'm very interested in the possibility of using PBM on her and seeing what kind of effect it would have. Thank you.
Any comments on that?
yes, we certainly, in the autism spectrum disorder, there is a large amount of research in clinical practice within PBM. Obviously, there is, as you would know, a large amount of dysbiosis with people that have autism spectrum disorder. So in our clinics and working with people at Boston University Hospital and in Canada who are expert in this field, we've been able to modulate the microbiome. It's more complex. Obviously, the earlier that we can treat, the better. But we have success with both our younger, very young autism patients and our slightly older ones, especially ones who are in the 3 and 4 that are non-verbal. We've been able, with this treatment, photobiomodulation, especially to the gut, plus some transcranial that Professor Casano is familiar with, being able to improve autism spectrum disorder, the quality of life for the young people and their families.
Yes, Dr. Elamir, excuse me.
I don't want to, if you want to finish the PBM.
Go ahead.
Yeah,
I'm just going to just add to the PBM. So there are now double-blind randomized clinical trials on PBM for autism, where they saw both the clinical improvement and also they saw the engagement of brain function in terms of brain oscillations that become faster, and that correlates with the clinical improvement. In our clinic in Mass General Hospital, we see people that are as young as 4-year-old for autism, and also teens. So definitely I echoed the experience of Dr. Liebert.
And I just wanted to add, as a fellow father of a child with autism, I can appreciate looking for the answers to not just causes but treatment. So we actually have a sister clinic in Dubai where the whole pediatric wing and the neuro team specialized in pediatrics, traumatic brain injury, but also autism spectrum disorder, where we've had improvement in communication as well as improvement in behaviors. The key is making sure somebody has signs on the analyses with the brain scans that there is something in the brain that can be respondent to the hyperbaric treatment. And if we see that, that's something we have good success with.
I'll just simply say that on this question of autism, as you all know, I mean, the new Secretary of Health and Human Services, Robert Kennedy Jr., has made it a #1 issue. They want to have fairly quickly some kind of indication of some of the causes of this, certainly this fall. I would hope that Dr. Casano, that you would share this information with the Department of Health and Human Services, especially if you're talking about random controlled trials. I mean, that's the gold standard of medical research. Certainly, they should be available to the government. The other thing I would just mention is that it is a crisis. The CDC has just indicated that it's one out of every 31 children in the United States is autistic. I looked at the comparative data, and in France, it's 1 out of 144. So there's something very desperately wrong in the United States, and we've got to figure out what it is. All right, ladies and gentlemen, unfortunately, this is all good things must come to an end, even a panel like this. So I want you to give our panel a hand. Before we close out, I just want to mention one basic fact, and that is that something you all know, but it's my experience in Washington is that the obvious is always overlooked. The fact is we are at a time where there's an inflection point in health policy. That is to say that there is a very, very serious change that has taken place, where liberals, conservatives, Republicans, Democrats are starting to recognize that we have to deal with the fundamental underlying health problems of the American people, and we have to address them with new, innovative, and imaginative solutions and take advantage of the technologies and the research that has already been done. There's a lot to be done. Ladies and gentlemen, thank you so much for coming, and thank you, panelists, for wonderful. Goodbye and God bless. Okay.